Hello, I'm Dr. Joshua Berkowitz. I'm the Medical Director of the Wimpole Aesthetic Centre in the West End of London. I'm going to speak about a range of common cosmetic concerns. Hello, today we're going to talk about how to treat acne. As we all know, acne is a very common condition which usually starts in the teenage years and usually finishes, for most patients, as they get into the late teenage years or into the early 20s. However, there are some patients who unfortunately will continue to have acne for many years beyond their teenage years, though perhaps not quite as actively and not as aggressively as when they were teenagers. There are a whole variety of ways of treating acne, and to some extent the treatment that is chosen for any particular patient should be appropriate to the severity of the acne, both in terms of the physical severity and also the emotional severity that the acne is causing. So for some patients, even though they have relatively mild acne, they may have quite a bad emotional reaction in consequence of having the acne attacks. The range of what is used to treat acne is vast, from topical application of various creams and lotions which can kill the bugs, to antibiotics, and further on to preparations which contain vitamin A, of which the most famous is probably a preparation called Roaccutane. Within the medical bag that any doctor has will also be a variety of advice on such things as eating well, appropriate foods to avoid, sometimes in women, control of their menstrual cycle, and of course there are some particular drugs which are called anti-androgen drugs which can also be used if it's appropriate. It's important to treat acne reasonably aggressively so that the attacks do not cause long-term skin damage and scarring. Most kids will outgrow the acne attacks in time, and for most young adults they will come through without any scarring at all. However, for those who do have long-term scarring, there will then be all the treatments that are available, such as laser resurfacing, which can help the scarring, but it's obviously best to not get and allow the acne to get into that kind of bad condition.